Transferring patients safely. Follow these steps for a one-person transfer from a wheelchair to an examination table. Place the wheelchair next to the examination table and lock the brakes. The side nearest the exam table should be the patient's stronger side to allow them to balance on that leg during the transfer. Place the gait belt snugly around the patient's waist and tuck the excess belting under the belt to avoid tripping or entanglement. Move the wheelchair's footrests up and out of the way. If the footrests are removable, that is preferred. Instruct the patient to place their feet flat on the floor. Assist them if needed. Position the stool in front of the examination table and as close to the wheelchair as possible. Instruct the patient to move forward to the edge of the wheelchair. Stand directly in front of the patient with your feet slightly apart. Remember, use good body mechanics and use your legs to provide any lift. Grasp the gait belt from underneath. Have the patient place their hands on the armrests of the wheelchair. At your signal, have the patient push on the armrests to assist in lifting themselves up into a standing position. If the patient appears to be steady, stable, and balanced, proceed by standing slightly behind and on the weakest side of the patient. Have the patient grab the handle of the footstool and instruct them to carefully step up. Assist the patient to pivot so that their back is toward the examination table. The patient's buttocks should be slightly above the edge of the table. Steady the patient and instruct them to place one hand on the safety handle of the footstool and one hand on the exam table. Follow these steps for a two-person transfer from a wheelchair to an examination table. Position one staff member in front of the patient and the other on the patient's weakest side. Both persons should grasp the gait belt from underneath. At your signal, have the patient push on the armrest to assist in lifting themselves into a standing position. The person nearest the exam table should move the wheelchair out of the way. The other person should assist the patient to pivot. Have the patient grasp the handle of the footstool. Instruct and assist the patient to place the foot on their strongest side onto the footstool. On your signal, both persons lift the patient onto the exam table. Follow these steps to transfer a patient from the examination table to a wheelchair. Place the wheelchair next to the examination table and lock the brakes. The side nearest the exam table should be the patient's stronger side to allow them to balance on that leg when descending from the table. Position the stool next to the wheelchair. Considering any patient's special needs, assist them into a sitting position on the table. Place the gait belt snugly around their waist, tucking any excess under the belt to avoid tripping or entanglement. Instruct the patient that upon your signal, they should push off the examination table, grasping the handrail of the footstool for support. Give the signal and pull the patient slightly toward you so that their feet land squarely on the footstool. Bending from your knees and hips, gently lower the patient into the wheelchair, controlling the rate of descent with the gait belt. Assist the patient to a comfortable seated position, lower or replace the footrests, and gently place their feet onto the footrests.